Hello everyone. We learned the common fractures at its locations in the knee last lesson. I believe you have mastered them. In this class, we will learn about common soft tissue injuries, including meniscus injury, collateral ligament injury, and cruciate ligament injury. First, we began to learn about meniscus injury of knee joint. Meniscus injury of knee joint is a common disease in clinic, which is more common in ball players, miners, potters, and so on. So, what causes meniscus injury? There are two external forces causing meniscus injury: lacerative external force and abrasive external forces. Most of the lacerative external forces occur when rotating the knee joint is in a semi-flexion position, and the meniscus moves backward. At this time, when doing interior and exterior torsion, the meniscus moves close to the femoral condyle, and the rotational friction shear force formed between the lower part and the tibia plateau is the largest. When the rotational crushing force exceeds the tensile force that the meniscus can bear, the lacerative injury of the meniscus will occur. When the knee is in the semi-flexion and abduction position, the femoral condyle will be suddenly rotated and pulled medially, which may lead to the breakage of medial meniscus. If the knee is semi-flexed at abduction position, the femoral condyle will be suddenly rotated laterally and straightened, which may also lead to breakage of lateral meniscus. Abrasive external force mostly occurs in the lateral meniscus because the lateral meniscus bears a heavy load. For people who have been squatting and kneeling for a long time, because the meniscus is abrased and compressed by the articular surface for a long time, the degeneration of the meniscus can be accelerated, and chronic lacerative injury of the lateral meniscus occurs. Meniscus injury can be divided into edge laceration, anterior corner laceration, posterior corner laceration, horizontal laceration, longitudinal laceration, transverse laceration, and so on. In anatomy, we learned that the meniscus belongs to fibrocartilage tissue, has no blood circulation, and only relies on synovial fluid to obtain nutrition. So the repairability after injury is extremely poor, and it is generally not easy to heal, except for the edge injury. Then, what are the clinical manifestations of knee joint meniscus injury? Clinically, knee joint meniscus injury can be divided into acute knee joint meniscus injury and chronic knee joint meniscus injury based on the urgency of onset. Most of patients in acute phase have a history of knee joint sprain. After the injury, severe pain, swelling of the joint and dysfunction of flexation and extension immediately occur in the knee joint. Because of severe pain, it is difficult to do detailed examination in acute stage, so it is difficult to make early diagnosis. Patients in the chronic stage or without obvious trauma history have a long course of disease and prolonged healing phase. The main symptom is knee movement pain, especially when walking and going up and down the hill, and some patients will develop claudication. When the knee joint extended and fixed, the slapping sound or interlocking sign appears on the knee joint. That is, when walking, sudden sharp pain occurs, and the knee joint cannot be extended and flexed, which is like interlocking. If the affected knee is slightly shaken or massaged for 2 to 3 minutes, it can be relieved and regain walking. During examination, it is found that the affected knee was not swollen or slightly swollen, and quadriceps is atrophied, compared with the unaffected side, especially the medial hip. Knee joint cannot be overstretched and flexed, and tenderness is in the joint space. If McMurray's test or Appler's test is positive, knee arthroscopy and MRI examination can be done to help the diagnosis if necessary. Based on MRI, meniscus injury is divided into the above 4 degrees. Among them, 1 degree is the lightest and 4 degrees are the heaviest. Among meniscus injury, the treatment of injury below the 2nd degree is manipulative therapy, combined with drugs, fixation, and exercise and surgical treatment, can be performed when the injuries above the 2nd degree or seriously affect the daily life of patients. I'm sure you have already understood the meniscus injury of the knee joint. Then, let's look at the collateral ligament injury of the knee joint. First, let's look at the etiology and pathogenesis of knee collateral ligament injury. The injury of collateral ligament of knee joint is mainly caused by the special structure of collateral ligament. When the knee joint is in the fully extended and fully flexed position, the medial collateral ligament is tense, and the knee joint is stable without lateral and rotational movement. When knee joint is in the semi-flexing position, the medial collateral ligament is loose. The joint is unstable. There will be slight lateral movement, and it is easy to be injured. The lateral collateral ligament is the most tension when the knee joint is fully extended and the most relaxed when it is fully flexed. When the lateral side of the knee is hit by violence or compressed by heavy objects, the knee joint is forced to have excessive vacuum and lateral rotation, which will widen the medial gap of the knee and cause strain, laceration, or breakage of the medial collateral ligament. On the contrary, when the interior side of the knee is hit by violence or pressed by heavy objects, and the knee joint is forced to have varus extensively, which will widen the lateral gap of the knee and cause strain, laceration, of breakage of the lateral ligament. Because of the knee joint have a physiologic varus angle, and the lateral side of the knee is susceptible to violence or heavy pressure, the medial collateral ligament injury is more common in clinic. If it is strong rotational violence, the medial collateral ligament is completely broken, and the medial meniscus and anterior cruciate ligament are easily injured, which is called the triad of knee joint injury. Serious injury may also be accompanied by articular capsule laceration and avulsion fracture. Next, let's look at the clinical manifestations of knee joint collateral ligament injury. Most patients with collateral ligament injury of knee joint have a clear history of trauma. After the injury, swelling, pain, and subdermal ecchymosis appeared rapidly in the knee joint. Local tendinosis is obvious, and the knee joint is impaired in flexion and extension. When the major collateral ligament is injured, the knee joint will be in a semi-flexed position, and neither active nor passive activities can strengthen or flex the knee joint. When the medial collateral ligament is injured, the tendon point may be in the medial epicondyle of femur, joint space, or medial condyle of tibia. When the lateral collateral ligament is injured, the tendon point is in the fibula head or the lateral epicondyle of femur. Lateral compression test of knee joint is positive. Intra-articular hematoma may occur in patients with meniscus or cruciate ligament injury or articular capsule lacerations. X-ray examination and MRI examination can help diagnosis. The treatment of collateral ligament injury of knee joint is manipulative therapy combined with medicine, fixation, and exercise. For those with partial breakage of collateral ligament, plaster support or over knee splint can be used to fix a knee joint in functional position for 3 to 4 weeks. However, patients with complete breakage of collateral ligament must be treated by surgery. After the operation, they should be fixed with plaster at 45-degree fixation position. After 3 to 4 weeks, the fixation should be released, and then the knee joint function exercise and rehabilitation should be gradually performed. We mentioned the triad of knee joint injury just now. That is completed breakage of medial collateral ligament, combined with the injury of medial meniscus and anterior cruciate ligament at the same time. Next, let's look at the knee joint cruciate ligament injury. The cruciate ligament of knee joint is deep, so unless it is severely violent, it is not easy to cause injury or fracture of the cruciate ligament. In general, most of them are caused by direct attacking violence against the knee joint. Generally, simple knee cruciate ligament injury are rare, and most of them are accompanied by injuries such as knee dislocation, meniscus injury, and lateral collateral ligament breakage. When there is a violent impact on the rear of the proximal part, the tibia can be displaced forward, resulting in anterior cruciate ligament injury, sometimes accompanied by tibia eminences avulsion fracture, medial collateral ligament, and medial meniscus injury. When there is a violent impact on the front of the proximal part, the tibia will be displaced backward, resulting in the injury of the posterior cruciate ligament, which may be accompanied by the breakage of the posterior articular capsule of the knee, the avulsion fracture of the tibia eminence, and the lateral meniscus injury. In clinic manifestations, patients with knee cruciate ligament injury may have obvious trauma history. The injury of cruciate ligament is generally a compound laceration, with severe pain and rapid swelling locally. Blood accumulated in joints. Those joints lose of original stability. Generally, the knee joint is in a semi-flexed position with obvious dysfunction of functional activities. And the floating patella test and drawer test are positive. It can be clarified and diagnosed by X-ray and MRI. Treatment is generally performed by manipulation, medication, fixation, and exercise. And surgical treatment is performed if necessary. In the knee joint disease described above, temporary fixation is required after all injury, and the exercise of knee fixation must be strengthened after the fixation is released. Surgical treatment should be selected for patients with complete breakage of cruciate ligament or injury of meniscus and collateral ligament to ensure the repair of knee joint stabilizer. When the knee joint is unstable after injury, you can wear knee protection to increase the stability of the knee joint. Well, this lesson is over. Please review and sort out the relevant contents. Thank you.